All right, thank you guys for being here this afternoon. So my name is Morgan Murphy, and I'm a Laser and Cosmetic Fellow at Mass General this year. And today I'm going to be talking about laser and energy-based device guidelines in dermatology. So here are disclosures. So giving you a little sense of some background here, as we have changes and improvement in device technology, we're seeing a need for evidence-based guidelines. And so there's been organizations and societies, experts and roundtables, and they started that process to develop guidelines. But the issue is that there's variable indications and methodologies amongst these groups. And so there's a need for a concerted effort to cohesively create relevant, evidence-based, provider-driven guidelines. And so that's actually underway at the moment. ASLMS is working on that initiative, and so the ultimate goal is to create guidelines. But a first step or a starting point was to do a scoping review of what guidelines currently are out there, what exists, what's in the literature so far. And so what we did is a scoping review of the literature. We used the search terms laser, energy-based device, guidelines, and recommendations. We used the Joanna Briggs Institute of Evidence Synthesis and Graduate Medical Education methodology for our scoping review. And what that entailed was first developing a research question, so what guidelines are out there. We did an initial scoping search, and then we went back and met as a group and kind of talked about what we found. We refined our questions and key terms. We then went back to the literature, filtered the results for relevancy, and finally collated and summarized the literature. And so I will show you here. Yeah, maybe this will work. Okay. So we looked at 423 articles, and 174 articles were deemed as irrelevant. And so there were 249 articles and 6 textbooks which we reviewed. And then we found 34 articles which were published guidelines. So where were these guidelines published? ASLMS is a big contributor, so there were 4 guidelines in the Red Journal, and then we had other different papers including Derm Surge and others, as you can see here. What guidelines have been published? Well, there's been guidelines about laser hair removal, guidelines for treatment of vascular lesions, guidelines for treatments of scars, and I'll keep going here and show you. The most recent guidelines that have been published was the guideline on acne scars, which was published in the Red Journal in 2022, and then a laser-assisted drug delivery guideline, which was published in JAMA Derm in 2022 as well. And then the types of things that there are guidelines about are things like laser hair removal. I'll add the caveat that the most recent guideline published for laser hair removal was actually back in 2012, and then also vascular lesions and scars. So what guidelines has ASLMS published? A few here, and they're written. So acne scars in 2022, traumatic scars in 2020, guidelines about treatment of vulvar and vaginal disease in 2019, and acne scars in 2011. And I'll just point out, if you look at the titles there, they're all kind of different, and some of them don't even have, the word guideline in it. And that really points to how important it is that we actually do this systematically, because even though we did identify guidelines in the literature, they're sort of different, and how the methodologies are all different, how they went about it is different, so it's not standardized. Considering treatment of specific conditions. So we also reviewed articles where they were guidelines about treatment algorithms or treatment recommendations for specific conditions that listed or included lasers or energy-based devices within that guideline. And so there were 76 such guidelines, and they included things like actinic keratoses, non-melanoma skin cancers, psoriasis, acne, and scars. So in conclusion, guidelines direct evidence-based use of lasers and energy-based devices, and clear guidelines offer an accurate point of reference for laser and energy-based device operators. So the compilation of guidelines by expert organizations such as ASLMS offers guidance for practitioners that can help prevent complications and improve outcomes for patients, and aims at creating guidelines should consider this scoping review to better understand the current literature and guide future efforts. Thank you.